Hello everyone. Today we will discuss about acute lymphoblastic leukemia. Acute means a disease which gets worse quickly is known as acute. And lymphoblastic, if it is written lymph, then it is talking about the lymphocytes. Lymphocytes are a type of WBCs. And blastic means the blood cells. The immature blood cells are known as blast, which are growing and producing in the bone marrow immaturely and in an uncontrolled manner is known as blast. And leukemia means the blood cancer. In short, this disease is known as ALL, and it is also known as acute lymphocytic leukemia. Means in some books it is written as acute lymphocytic leukemia or acute lymphoid leukemia. And this disease is very rare in adults but very common in children. Leukemia is of two types, lymphoid leukemia or myeloid leukemia. In lymphoid leukemia, the lymphocytes are involving, whereas in myeloid leukemia, the WBCs other than lymphocytes are getting involved. In myeloid leukemia, the WBCs other than lymphocytes they are growing uncontrollably and they are forming a crowd, due to which morphological derangement of RBCs, platelets, and lymphocytes are occurring, which is producing the symptoms. So, what is happening in ALL? In this slide, you can see two pictures. The first picture is showing the normal blood, in which the RBCs are more in number and leukocytes are less in number and platelets are also less in number. But in second picture you can see the WBCs means the lymphocytes are more in number and they are forming a crowd, due to which the morphology of RBCs and platelets are also deforming. And due to deformation in the morphology of RBCs, platelets, and other WBCs, they are not able to function properly, due to which symptoms such as anemia, recurrent infections, and bruising are occurring. Etiology. What are the causes which are responsible for acute lymphoblastic leukemia? The first cause of leukemia can be radiation. Radiation means ultraviolet radiation from the sun can also cause leukemia. And if a person have gone through any radiation therapy to treat any cancer, he can develop leukemia after the radiation therapy. And if a pregnant woman is exposed to radiation during her pregnancy, then the radiation can harm the fetus, and the fetus after birth can develop leukemia. And radiation in low doses will not harm our body, but radiation in high doses can. The second cause of leukemia can be benzene. Benzene is mainly found in cigarette smoking and in cosmetics. So the person who are smoking cigarette regularly or are working in any cosmetic factory can develop leukemia. Benzene enters our body through our respiratory tract and then it goes to the liver, and from liver by the help of blood it goes to the bone marrow. In bone marrow it is destroying the function of the stem cells, and when the stem cells are destroyed, when the function of the stem cells are destroyed, stem cells are not able to make mature the lymphocytes, and due to this reason the lymphocytes are getting immature and they are forming uncontrollably. The next cause of leukemia can be HTLV1 virus. HTLV1 means human T cell lymphocyte virus. This human T cell lymphocyte virus is mainly sexually transmitted and it can also transmit through an infected needle. So what this virus does, it do cell to cell contact. Cell to cell contact means it goes to the bone marrow. In bone marrow, the immature lymphocytes are present and it is motivating the immature lymphocytes to grow more immaturely and more in number. The next cause of leukemia can be Down syndrome. In Down syndrome, trisomy of 21st chromosome happen. In a normal human being, In 21st chromosome, GATA1 gene is present. This GATA1 gene is responsible for development of mature lymphocytes. And due to Down syndrome, due to trisomy of 21st chromosome, mutation in GATA1 gene is occurring. Due to mutation of GATA1 gene, there is development of immature lymphocytes, development of uncontrolled immature lymphocytes. Manifestations. What are the causes of manifestations of leukemia? A lack of RBCs, a lack of WBCs, and a lack of platelets. Due to change in morphology of the red blood cells, there is lack of normal red blood cells. And due to lack of normal red blood cells, there are symptoms like fatigue and weakness, dizziness and lightheadedness, feeling of cold, and shortness of breath. And due to lack of normal white blood cells, there are symptoms like recurrent fever and infections, severe and more infections, and enlarged lymph nodes and loss of appetite. And due to lack of platelets, there are symptoms like bruising, gingivitis, epistaxis, and petechial hemorrhage. And these are the symptoms which develop in the initial stages of leukemia. These are not the confirmatory symptoms of leukemia. Confirmatory symptoms of leukemia are hepatomegaly or splenomegaly due to accumulation of cancer cells in the liver and spleen, enlarged axillary, cervical, and supraclavicular lymph nodes, pain in bones and joints, and headache, vomiting, and seizures or blurred vision if the cancer has spread to the brain, and there is dyspnea if the cancer has spread to the chest. Investigations. Investigations need to be done in acute lymphoblastic leukemia. First investigation is CBC. CBC means complete blood count. In CBC, we can determine the normal count of the blood cells. And peripheral blood smear. In peripheral blood smear, we can see the morphology of the blood cells. Second is bone marrow test. Bone marrow test is done to diagnose the normal functioning of the bone marrow, whether the bone marrow is producing normal blood cells or not. And third is imaging test. Imaging tests like X-rays, CT scan, and MRI. In X-ray, CT scan, and MRI, we can see the thinning of the bones in acute lymphoblastic leukemia and enlargement of the lymph nodes. And last is spinal tap. Spinal tap or lumbar puncture. It can tell us whether the cancer has spread to brain or spinal cord. Stages of leukemia. There are primarily three stages of leukemia. First is untreated. In the stage of untreated, the cancer is undiagnosed in this stage and the symptoms are only treated but the cancer is still present. And the second stage is remission. In remission stage, the cancer has been diagnosed, the symptoms are treated properly, and the CBC is normal in this stage, and only 5% leukemia cells are present. And the third stage is recurrent. In the stage of recurrent, the cancer has reoccurred again after treatment. Treatment. Treatment of acute lymphoblastic leukemia is done in a sequence. First is chemotherapy. In chemotherapy, drugs are inserted intravenously to kill or slow down the cancer cells. Second is targeted therapy. In this therapy, drugs are introduced into the body intravenously to a specific or a target area where the cancer cells are present. Third is radiation therapy. It is done if the cancer has spread to brain or the spinal cord. The fourth sequence of treatment is immunotherapy. In immunotherapy, drugs are introduced intravenously into the body to boost the immune system. And the last treatment is stem cell transplantation. It is done after chemotherapy and radiation therapy to grow into normal healthy cells. Prognosis. In acute lymphoblastic leukemia, if the age of the patient is young, then the prognostic factor is good. Blood examination. In all the blood examinations, if WBCs are low, then prognosis is very good. Chromosomes. If there is presence of Philadelphia chromosome is formed by adjoining of chromosome number 9 and chromosome number 22. And Philadelphia chromosome is the hallmark for leukemia. If this chromosome is present, then it will decrease the prognostic factor. Response to chemotherapy. If there is no evidence of leukemia 4 to 5 weeks later to chemotherapy, then prognosis is really good. It tells the prognostic factor is really good. So, this was all about acute lymphoblastic leukemia. Thank you.